Good morning, good afternoon, good evening, and good night, depending from where you're watching and listening to me around the globe. I am Mbonu Silas. By vocation, I'm a Catholic priest. By profession, I am a licensed clinical psychologist. In my YouTube therapeutic series on conquering bad habits, today I want to continue with the second episode of the video I started on personality disorders and how to handle them. So, what are personality disorders? They are mental behavioral disorders or illnesses that are characterized by behavioral mental patterns of thinking and lifestyle that affect negatively the individuals and people around them. According to this book, DSM, Diagnosis Statistical Manual of Mental Disorders, these personality disorders are grouped into three clusters. Cluster A is on paranoid personality disorder. It is marked by extreme characteristics of suspicion and distrust. So people who have these personality disorders, they don't trust anybody. They suspect everybody. They accuse everybody that they are against them. Then you have the schizoid personality. These people, they are withdrawn from the society, from social activity. They are not in touch with reality. Then you have the schizotypal personality disorders. This personality disorder is deeper than the schizoid, and they have the same characteristics with schizophrenia. But personality disorder, such as this, they have characteristics like hallucination, delusion, bizarre movement, and gestures and speeches. Then when you go to cluster B, the first is the antisocial personality. People who have this personality, they tend towards breaking rules and regulations and laws in the society, in the family, in the school. These are offenders, crime offenders in the society. Then you have the narcissistic personality disorder. These are people who are self-centered. Every attraction must be on them. Every attention must be on them. They use the word I, me, I alone, I before others. I should be at the center. Then you have the histrionic personality disorder. These are people who like to attract attention towards them. Wherever they are, people must notice that they are there. In the meetings, they must talk. You must know that they are there. They think that the world revolves around them and within them. Then you have the borderline personality. They have a marked impulsivity and unstable interpersonal relationship. So they oscillate on that borderline between impulsion, impulsivity, and instability. Then we'll go to the cluster C. In this cluster C, you have the first that is called avoidance personality disorder. People who have such personality, they avoid every social activity, avoid people, and they avoid growth because they don't want to be criticized negatively. They don't tolerate criticism at all. So what they decide is they stay on their own. Then you have people who have obsessive compulsive personality. These are people who are obsessed and compelled in doing things over and over again. They have a mark of perfectionism in them. So these people, you cannot satisfy them. You cannot please them. They are workaholics. Then you have the dependent personality. These are people who are excessively submissive and reliant on others. They always say, I cannot do it alone. I need somebody to help me. I cannot be alone. I need the help. I need the help. You must do something. They have dependent personality. Okay, what are the causes of personality disorders? There are no known causes of personality disorders, but we can talk about some of them. Can be genetic, hereditary, can be biological through the formation of the baby in the womb. A brain damage or injury or malformation can lead to a personality disorder. It can also have some sociological causes, maybe poor family upbringing, poor family training, poor parental upbringing can lead to that. Then it can also have medical issues. Maybe an illness can lead to that. If you have depression, it can lead to it. And also it can have peer pressure, social networking that is negative, then poor psychological formation from infancy to adulthood. Then there are other unknown causes. Then what about the effects? The effects are three. You have the medical effect, then you have the social, cultural effect, then you have the psychological effect. The medical effect, people have such, they can develop like headache, and they have mood swings, they are unstable, so they need attention of the medical doctors. Then those who have the social cultural effect, they cannot relate with anybody. They cannot be in the society. It will find it hard for them to cooperate or collaborate with people and work with them. Then you have those who have the psychological effect. Psychological effect, like they have depressive disorder, you have post-traumatic stress disorder, and also you have the anxiety disorders. Okay, what are the risk factors of personality disorders? The risk factors of personality disorders, they are also the same with the risk factors of other mental illnesses or disorders. But one risk factor may not be the same risk factor to another individual. So people vary, but all the risk factors are negative. Then let us talk about the diagnosis, the prognosis, and the therapy for personality disorders. All of them can be diagnosed using this book, Diagnostic Statistical Manual for Mental Illnesses or Disorders. But you can apply subjective method or objective method or projective method. Then, what are the prognosis? The prognosis depends on the level of severity. Is the personality disorder, is it mild, is it acute, is it chronic? And it depends on the therapist and depends on the candidate or the patient. It also depends on the type of therapy that can be offered or preferred. Okay, let us talk about the therapy. Is it treatable? Yes, it is treatable. There can be a medical therapy. If, for instance, the person has a depressive disorder, it leads to depressive anxiety disorders, it can be applied antidepressants or other pharmacological medications that will be helpful. The other method is self-care. You change a lifestyle that is negative. You avoid occasions that lead you into bad lifestyle, into personality disorders, because no personality disorder is positive. All of them are negative. Then lastly is psychotherapeutic method. The fourth is cognitive behavioral method. This deals with their cognition, the pattern of your thinking, determines the way you feel and also the way you act. And you have what is called the dialectical behavioral therapy. Then you can also apply the schema focused therapy. You can apply the mentalization based therapy. You can also apply the system training for emotional predictability and problem solving therapy. It is called STEPS. Then the person can be sent to a rehabilitation center if it is acute or chronic. The person can go into a formation center where clinical psychologists can be of help. Then you learn coping skills and other behavioral mechanisms. So when you apply all this and with a cooperation and therapeutic alliance between the individual and the therapist, I believe you will get to your goal for the treatment option that you have chosen. In my next video, I'll be talking about the human sexuality and also the sexual disorders and how to handle them. You can share this video. You can like this video. You can comment. You can also subscribe so that we'll reach to people who need this video. Everybody has an iota of personality disorders. It depends on the level and how you manage your own. You can contact me through my email mbonugona@yahoo.com or mbonugona@gmail.com that you will see on the screen. We can help you to do a diagnosis so that you know your own personality disorders and you can seek for help on how you will be treated. Many have called me, many are calling me, many have sent me emails and also messages, and we do private online therapy. Thanks for listening. God loves you, and so do I. Bye.